Hi, my name is Megan Riley. I'm a speech-language pathologist working at Functional Speech Therapy in Fox River Grove in Illinois. In this video, I'll be talking about how to model AAC devices, also known as aided language stimulation. Oftentimes, when a child receives an augmentative and alternative communication, or AAC, device, all of the therapy time is spent teaching the child to use the device. However, therapy sessions are only for a couple of hours a week. For AAC to be the most effective, everyone who interacts with the child should be modeling the device, especially family members. Now, I understand AAC devices can be very intimidating at first, especially if it's a high-tech device with a large vocabulary. However, it's not as scary as it seems. I'll be talking about some tips for aided language stimulation and then doing some demonstrations. Tip number 1, don't model every word. If you're just starting with AAC, only model one word per phrase. Now you're still saying the whole phrase, but only selecting one or maybe two words from it. So if you're saying, let's go to the store, you can model go. Or you could model go store. Once you're more familiar with the device, a good rule of thumb is to model equal to or one more than what your child is already doing. So if your child is selecting one icon spontaneously, model 2 words. Now if your child is starting to string 3 words together, it may be time to model the same phrases using correct grammar, like
going to the store. Going to the store.
Like going to the store. Tip 2, focus on core words. Core vocabulary are the words that we use most frequently and are typically the home page or only page of an AAC device. When deciding which word to model for a given phrase, default to these core words. Not only are they used more frequently, but they're also easier to access. This is why I would model go in the phrase, let's go to the store. Tip 3, do not expect your child to respond or imitate you, especially not right away. In the beginning phases of AAC use, our role as the child's adult is to demonstrate the device as frequently and in as many settings as possible. An 18-month-old child who is using verbal speech is exposed to 4,380 hours of spoken language. If a child is only receiving AAC models for 20 to 30 minutes twice a week, it would take 84 years to receive that same amount of exposure. Now, we don't expect an 18-month-old to speak perfect English, nor should we expect an AAC user to learn the device immediately or without demonstration. Tip 4, do not expect perfection from yourself. Hitting the wrong button is part of using AAC. Model that errors are a part of navigating the device. So is having to hunt for buttons, especially at the beginning. Tip 5, take time to explore the system without your child. Now, it may take no time at all, or it could take quite some time to know the location of all of the available icons. We expect the user to explore the device and enjoy selecting buttons without a lot of meaning. Give yourself that same time. The better that you know the device, the better you can model it for your child. Now, as I mentioned before, the goal is to model in as many situations as possible. So I'm going to give a few examples.
Okay, it's time to get dressed. What do you want to wear today? We're gonna go outside, so we might need some pants. Because it's a little cold. Should you wear the black pants or the brown pants? Oh, you want to wear black pants? Okay. Now it's snack time, and I think I want to eat some chips. Yum! Now it's time to do a puzzle. Let's put in. Go in. Let's finish the puzzle. Maybe your child loves to build a tower. We're gonna put more blocks on. I want more. Put more more. Or maybe it's time for everybody's favorite part of the day. Story time. Well, we've finished reading this page. Time to
turn the page, please.
Ah, and we asked so nicely.
Now it's your turn. Time to practice modeling your family's AAC device. If you need other ideas or any additional information, don't hesitate to reach out.